Now by Republican Congressman Pittenger of North Carolina, who is working to repeal Obamacare and who attended that meeting with Mike Pence earlier today. Congressman, great to have you with us this evening. I want to ask you, sir, about these two dueling statements that came out of this press conference earlier today. On one hand, you have Vice President-elect Mike Pence saying this is going to be the target on day one. In fact, you could possibly see some kind of executive order action by President Trump on day one to repeal Obamacare. But then you also see House Speaker Paul Ryan saying that they don't want to pull the rug from under the Americans that are currently being covered by Obamacare. What do we expect to happen on day one in regards to Obamacare?
Well, the reality is Obamacare is not sustainable. It actually will not perform. And that's the problem we have today. The premiums are going skyrocketing, so are the deductibles, and the coverage is not there. The Democrats have said, well, 20 million people are covered. Well, in reality, that's a survey on their part. In reality, it's only about 14 million people. Jonathan Gruber, who was the architect of Obamacare, said that most of the people on Obamacare today really were covered by Medicaid. So it really hasn't had an impact, and yet at the same time, you have 28 million people who don't have coverage at all. What we need is affordable health care, one that is that the American people have a choice. And it'll be delivered to them through competitive markets that has open competition through the states. It has tax credits for individuals, just like you have for a business. Right. Individuals can band together. They'll be able to buy together to have group rates. But and of course, we're going to have Medicaid reform, Medicaid liability reform. I led that in North Carolina. Reduce the cost significantly because 30% of the tests performed by physicians today are performed to protect themselves from lawsuits. So let me things we'll do.
Fair enough, Congressman. 20 million or 14 million, that's still a lot of million Americans that are still getting some kind of coverage, whether it be through Obamacare or expanded Medicaid.
And as Jonathan Gruber said, most of those people are already accepted to be covered through Medicaid. That's from Jonathan Gruber. He was the architect of Obamacare.
So okay, let me put this up for you. This is a Gallup on percentage of Americans without health insurance. This was back in 2009, 16.4% in the fourth quarter. That's people without health insurance. That number in the third quarter of 2016, 10.9%. That number has gone down significantly. What are you attributing that to? If Obamacare is not helping more Americans get insured, how do you explain that drop?
Just as Jonathan Gruber said, the architect of Obamacare, he said most of the people, 2/3 of the people who are covered today are covered because they were entitled to get it through Medicaid. It really hasn't had a dramatic effect, except for limiting competition, limiting the market access. That's what drives prices down in any market, and that's what we need to have today, and that's what we will have. We're going to deliver this for the American people. This has been an abysmal failure owned by the Democrats. Yes, it's theirs, and they wrote it through without anybody to even review the document, and they have to live with the failure of this reality.
All right, the Committee for Responsible Federal Budget says that repealing without replacing Obamacare would cost about $350 billion through 2027. It's been about 6 years that that Congress has been controlled by Republicans. They haven't put forward another plan to replace Obamacare. Why would they be able to do so now in this Congress?
Well, we have the plans. I'm a co-sponsor of two plans, one that came out of our Republican Study Committee, which
So which plan is going to replace it? Which plan is going to replace Obamacare once you guys repeal it? We're merging those
plans now. If you'll go look back in January 2009, the Democrats didn't have one single plan either. Yes, these plans are being merged today, and there will be a plan, and it will be a competitive, market-driven plan that will deliver the best product for the lowest price to the American people.
Are you at all concerned by the Democrats on the other side of the aisle saying that, they're not going to help you come up with another alternative for Obamacare? It's yours now to own. We heard Senator Schumer.
We don't want their help. Their help is socialized medicine where the federal government is dictating it. The American people want choices. They want to pick what parts of health care that they really want to have. They don't want to have it shoved down their throat as one size fits all. That's what they're given. I'm frankly a 68-year-old man. I don't need maternity assistance. I don't need baby care assistance, but that's mandated. No, the American people are going to be able to pick the medical assistance and support that they need.
Do you believe, Congressman, there are some parts of Obamacare that are pretty popular, including, the children staying on their parents' coverage until 26?
That's always been in our plans. That's in every every plan I've been a sponsor of the last 4 years.
So what specifically in Obamacare would you want to see immediately done away with, since some of those are probably going to stay on in some capacity, whether it's your plan or Obamacare?
What's the mandates? It's all about government mandates,
right,
and the government dictating what the American people have to have. The American people want choices, and also have competitive open markets. When the government is the only one controlling the markets, you clearly don't have the advantage of a competitive market, and that's what drives prices down. Look at LASIK surgery. A decade ago, it cost $10,000. Now it may cost $800. The markets drive down prices. That's what we're going to do with health care.
All right, Congressman, it's great to have you with us this evening, sir. Thank you very much for that perspective.